creating a representative and a clinically applied atlas, which you've heard both through the diversity and disease efforts, and through all of this program, we are enforcing our diversity and global representation effort. So in terms of our calls to action, I'll start. Calls to action. And so some of the first takeaways from our first session, we're really proud that after years of work, reorganizing our data ecosystem, centralizing our effort, we have now achieved our goal of having 50% of the atlas already endorsed by our organizing committee. We have 8 of them already done, 2 more to be done in July. In total, we'll have 7 more approved by the end of the year and only 4 left for next year's. Calls to action. We will still be, when I say we, it's going to be BioNetwork coordinators, and might be members of the integration team. Reach out to you if your data sets were selected or you contributed your data sets, and ask you for specific information about your data, metadata, which could be technical or biological. And so when we reach out, we please ask you to answer our emails and do follow-ups and ask us questions. I told you about annotation jamborees. For those of you that were not actively involved in the integration, this is your chance. Everybody has a chance to participate in these first base atlas we're going to be released. You get to be heard. You get to tell us if you agree or not disagree. Please get involved. And we need to be laser focused on finishing these atlases. These are going to be the base atlases. And by doing this annotation jamboree, we're going to make them useful, actionable, functional. In terms of our future goals, we're going to push forward under the angle of cross-tissue reference to integrate them across organ system. That's especially important for the cell types that are shared across organ system so that they don't live in a silo, whether it's immune, adipose, vasculature, stromals, and so forth, musculoskeletal. We're going to be compiling the results from our annotation jamborees to define where we agree, but as importantly, where we disagree. There might be, that's going to help us focus our effort. Maybe we need additional modalities. Spatial will, of course, also help refine this information. And we're going to, through harmonizing the cellular identities across organ system, through the cell annotation platform, it will enable us to generate really key spatial panels across the biological network that will help us propel in the next phase of our spatially resolved atlas. So I'm going to pass it on to Holger.
Yeah. So what we learned, I think, in this meeting is that the 1 billion is a new 1 million. There was actually a meeting in 2017 in Israel, and Eric Lender asked on stage to Sarah and Aviv and Amit how many cells are needed to build a human cell atlas. And back then, we still were processing cells in plates, not even in droplets. And I think the answer was like 1 to a few million. And I think what we learned yesterday is that we can do many millions now in a day or in a week. So that is obviously a game changer, how we look into the future. It's accelerating the way we're building atlases at scale across one dimension, but also spatial technologies allow us to have these cell numbers in 2 or even then eventually 3 dimensions. So homework for us is really to work on technologies that are not yet scalable enough, and specifically to work on tissue and organ panel designs that will, especially for the spatial imaging methods, allow us to scale rapidly and cost efficiently across the BioNetwork, but eventually the global community. For this, we already have discussion about partnerships, not only for generating those panels, but also to help us scaling efforts from initial pilots over flagships to full MVP product designs. And MVP is a crucial element in the roadmap, and it's really where we need feedback from you, because an MVP has to be actionable, has to be informative, and this is something we have to define together as a community, together with biotech and also pharma partners. At the end of the process, there will be a more comprehensive foundation model, and I think we are uniquely positioned to have an open source model. There are many models being built by private companies or by venture capital backed institutes, but as a community, as a Human Cell Atlas Forum, we will have an open source model that I think will empower the entire community moving forward. Future goals, it's what we discussed yesterday in the breakout session. is implementation of initial multimodalities, especially protein has been discussed to have a clearer link, especially towards the clinical environment. And obviously, moving forward, we need to be better in implementing the three-dimensional context, either through thicker sectioning, but also obviously eventually screening across entire tissues and organs.
Thank you, Holger. All right, I'm going to talk about diversity. First, a big shout out to everyone who spoke in the diversity session this morning. I don't know about you, but I was just incredibly inspired to see the quality of the science and the insights we're getting into that. I hope you got the message from that session and from all the other speakers actually in this meeting who incorporated diversity in their research, that this is really essential for the Human Cell Atlas. As Patty put it, without inclusion, without diversity, the Human Cell Atlas is incomplete. And why is that? Because we really need diverse cohorts and diverse geographies to make better discoveries, make better biological discoveries, to improve healthcare, because you cannot, the criteria and diagnostic criteria, disease incidence, everything is different in different parts of the world, and to advance equity so that we have medicine for everyone, not just for some parts of the world, right? And the science is really coming in now to turn these kind of general principles into concrete examples of how they're true, right? And that's because ethnicity, age, and sex influence everything about our biology. They influence cell proportions, even something as simple as your CBC, monocyte lymphocyte ratio on your health checkup. That ratio is influenced by your ethnicity, by your age, by your sex, by everything, right? And your cell states at a final level, of course, they're profoundly influenced by various factors, aspects of human diversity. Your risk of getting virtually any disease depends on where you are in the world, what your ethnicity, age, sex are. And then the severity, your disease physiology, your drug response, all of that is variable across the globe. And we saw from Yusuf's talk that something as simple and underappreciated as diet can have a profound influence on your biology in a way that influences your disease susceptibility and your disease physiology. So let's get to that. And then in terms of calls to action, I would say turning those into concrete programs, right? Capacity building is a big goal for the Human Cell Atlas. We do have to build capacity to empower local science, local researchers to do this kind of research. And that means also not just the researchers, but community engagement to understand what their needs are, what they want to see out of research, what kind of research they want, and in what way they want to participate in the research, what they want you to do with the data for their benefit and also for sharing in the world. And then based on that capacity building, based on that community engagement, we hope you will all build diverse cohorts across the globe to advance human health. And along the way, as Chloe said, submit data, submit metadata, answer our emails. In this case, drive these diverse, lead and drive and participate in these diverse cohort studies. And I want to emphasize tier 2 metadata. We, as Kian Hong, I think, mentioned, the HCA Diversity Task Force report has been ratified, and part of that report is the diversity tier 2 metadata spec for the Human Cell Atlas. I hope you will all peruse that and submit that data so that we can understand the relationship between cell states and aspects of lifestyle and ethnicity and age and so on. Future goals, we've talked about ethnicity, age, and sex. Those are the major axes of diversity that we're focusing on. In some sense, highly important and relatively easy to ascertain. The more difficult thing is environmental influences, you know, how much particulate matter you were exposed, pollution you were exposed to, how much do you really exercise, what environmental toxins you were exposed to, your lifestyle diversity and so on. All of that, and even diet, as Yusuf was saying, in his case, he did have a diet questionnaire, but it's not straightforward. But all of these things influence our biology. And so our future goal is to go beyond ethnicity, age, and sex to see all the environmental, lifestyle, non-genetic influences on our body. Thank you. And next is Muz.
Thanks, Shyam. So I will be covering disease today, and really to create a clinically applied atlas is one of the key aims and vision over the next few years. Firstly, the takeaways, and in many ways, the Human Cell Atlas has focused on generating a healthy reference atlas that's going to be functional and usable to understand disease. Even when I first joined HCA, I always wondered why we weren't doing disease. But I remembered my PhD when I tried to understand disease, but actually I ended up having to work out what were the different cells in that tissue in order to understand disease. So I think the journey that we've taken is the correct journey, and we are now ideally poised to use all of the learnings to move into disease in a very strategic and comprehensive manner. But what disease is going to be quite important. HCA is not going to be able to do every disease, but also HCA, what role should HCA be in advancing our understanding of disease? Because many groups can do small studies, but where I see HCA really taking the lead is large consortia-like activities. And I think COVID-19 taught us that and taught us the value of it, being fast, working together at a global scale, being able to identify viral entry receptors and generating data from patients that are actually comparable, because we've discussed the strategy of how we should do the analysis and data generation, and also how we can apply this now moving forwards to larger disease activities. We have done a disease-focused survey, and it talks about the importance of identifying diseases that are global burden, and there are recurring themes in terms of cancer, autoimmunity, and infections. But maybe we should rethink, and actually, I would like to really encourage all of you and everyone who is not here today but would like to be part of the HCA to contact us through the HCA Executive Office and to highlight what could be disease priorities, and particularly disease priorities where there are tissue banks. The reason is one of the biggest health impact is also neurodegenerative diseases, and that affects everywhere, all of us around the world, and something that we will have to make great strides into for our existence on the planet. So calls to action, please contact us about the disease focus and also in the tissue banks. With regards to future goals, I'm going to borrow this term that I've learned from this meeting, GLOCAL, which is global yet local, having modular consortia, and I highlight one that is closer to my heart, but one that I also can understand with regards to the activities on skin that could be done in Asia, in Europe, and everywhere. And that's one where I really see the value of the HCA community in enabling this much bigger study, bigger than what any one of us could do or any one institute can do. So it's these types of modular consortia that we need to encourage and develop and have the right approach in terms of how we do the science to achieve this goal. It comes obviously with training, capacity strengthening all around the world, and also the ability to actually generate data in a cost-efficient manner. And for all of this, we will need agency with national and regional networks, working with our scientific partners, including technology companies, industry, and pharma, and to really make progress as a collective whole so that it is far greater than the sum of our individual parts. That's it on the disease front. And before the four of us finish, I wanted to thank Shyam and Jay, but maybe Chloe has a different idea.
Well, we'll definitely thank them at the end, but Shyam wanted to use the 5-6 minutes we have before the concluding remarks to ask whether there were any questions or comments in the audience. We have very little time, but if there's any burning comments or question. And it's been a long meeting. Totally okay if you don't have any. We're also fried. Okay, well, I hope we're not fried enough to do one more round of applause for our amazing host, Jay and Shyam.
I'll start. We obviously didn't prepare, but yeah, I think we are now at the closing session, and we just gonna show you some few slides, and then we'll let you go, promise. And we'll just take turns. And I just want to thank everyone for staying till this day. In fact, we are not done. There'll be day 3 and day 4 for regional network meetings. It's happening here tomorrow, and on Friday it will be in Biopolis, where A-Star is. So we're really looking forward to continuing this discussion on regional networks. So it's 2 + 2, and today we had, for the past 2 days, we have 47 countries represented, over 631 attendees. Congratulations to everyone, it's amazing. 5,000 plus emails from HCA office, so big thanks to Christine and the team for, man. Hopefully ChatGPT was helpful, I'm not sure. 100 posters to 63 speakers and session leads, 43 talks, thanks to all the speakers, and 9 breakout sessions. So amazing productivity in the last 2 days, and I think this is just a great sign of your participation. So thank you for the great meeting. So I'll pass it over to Shyam.
5,000 meetings, blown away. And blown away also by the size of this crowd, so really excited. We want to hear your feedback, as always in HCA meetings, so please check out the QR code, good, bad, constructive, hopefully. Give you a few seconds for that. All right. And recordings are available, as always. So if you missed any of the talks or wanted to review again, it'll be up on the YouTube channel, I think, most likely. You'll get a certificate of attendance if you need it for your claims or anything like that. And something so big, so lots of people to thank. First off, our platinum sponsor, 10x Genomics, thanks very much. And our gold sponsors as well, Atrandi, AWS, Helmsley, Illumina, Roche. And then our industry partnership program members, which will help us drive our research forward, GSK, Johnson & Johnson, Roche. And of course, operational support, which keeps us alive and keeps the backbone of HCA going. CZI, Cloudman Family Foundation, and welcome. Program committee, who if you felt the speakers were good, program committee are the ones to thank for that. Apart from Jay and myself, Piero, Muz, Musa, Joseph, Aviv, Patricia, Sarah, Chloe, Zerman. And scribes and mic runners who helped all of you express yourselves and helped to record the proceedings. Long list, I won't read it out. But yeah, they made the meeting as participatory as possible. and our event and AV and catering staff. So I hope you felt the food was plentiful and good, and all of the tech worked well for you. So Biju, the team from Grain for catering, Allmaster was the exhibition company, and Daniel Tan, our photographer with the wonderful camera. And special thanks also for the HCA exec office support for the website and for the text and everything else. Oh, there we go. Okay. So Anya, Kate, Jenny, Aiden, Dave Rogers, and the exec staff. Long list. Those 5,000 emails didn't all come from one person. So I think mainly came from Christine, but a lot from others also. So thank you, Aya. Thank you, Yoshi, Esther, Bridget, and John, Lucia, Christine, Ellen, Sam. Thanks very much. Upcoming events. Yeah, if you love this one, you will enjoy the sequel even more. So always on the HCA events page, you can find out what's coming. Excitingly, 2026 Human Cell Atlas Asia venue has been decided, and it's going to be in Perth, Australia, hosted by dear HCA stalwart Al Forrest. And 2027 HCA Asia meeting is going to be in the beautiful tourist island of Jeju in South Korea, hosted by Woong Yang Park, one of the co-founders of Human Cell Atlas Asia. So hope to see you at both of these amazing places. If you've seen Ratatouille, the refrain is anyone can cook. So anyone can contribute to the Human Cell Atlas. Please make your data heard. HCA Hub is a new platform where HCA members can connect, chat, collaborate. Please join HCA Hub, and you can continue talking to each other even after this meeting. And is that it? Oh, did I? Oh, maybe over to you, Sarah.
Yeah, I'll take over from Shyam and just finish off by adding that, of course, you can register for HCA and any of the biological networks or the working groups. Please visit the website for updates. This is a reminder of tomorrow. We have the tech sessions in the morning with AWX and 10X. And then we have the afternoon sessions with data portal here, and then the regional networks. So I will be there tomorrow, and I look forward to interacting with everybody who's still there. And finally, day 4, Illumina Showcase and Genetic Diversity Collaboration between Asia and Latin America. So this is the end of the main session, the first 2 days. It's been amazing. Thank you everybody for coming, for contributing. And finally, thank you to Jay and Shyam. See you next year.